Now, how do we test for gluten sensitivity? One of the first things you can do is just pull gluten out. When I say gluten, I'm really talking about all grains because you have the wheat, barley, rye, right? But then you have the corn, oats, rice, right? And then you have the different pseudo grains like quinoa. Quinoa is kind of in that family as well. It's kind of more of a pseudo seed. But you have these other grains, and if you're overly sensitive, you could still develop an immune response to these foods. So I would have you go cut 100% grain free, and that really allows any of that potential mistaken identity, that molecular mimicry, that cross reactivity, it pulls it out of the equation. And then the question is, do you feel better? Right? Do you have less inflammation in your joints? Do you feel better? Do you have more energy? Do you have less brain fog? These are all important questions you'd want to ask yourself. And if you notice an improvement, that's a good sign that you should probably keep those foods out. Also, when you start to plateau symptom-wise, let's say over a couple of weeks, you're starting to feel better, you're starting to feel pretty stable, start to add a little bit of these foods back in. How do you feel? How does that challenge feel? Do you start to feel a little bit worse? These are good ways to kind of know. Also, other foods I typically would cut out along with gluten or grains in general. I would also cut out nuts and seeds. I'd also cut out even eggs. Even I love eggs too. They're so good, or butter. I go on a full-on autoimmune type of paleo template as a starting point. If that's too much for you, just start off with a paleo template. Just cut out grains, legumes, and dairy. Start there. See how you feel. Once you get really clean, right, metaphorically, and you start to add something back in that dirties you up, you notice it, right? Because you created this massive contrast. You've reduced inflammation. So when you add something in again that's more inflammatory, you notice that big jump up. And so regarding testing, I would say an elimination, provocation. Elimination means you pull it out. Provocation means you test it. You introduce something back in. There's also blood tests that you can do, whether it's transglutaminase antibodies, endomysial antibodies, deaminated gliadin. These are looking at the different proteins on the gluten, or the endomysial or transglutaminase is looking at these different translational enzymes that impact the nerves in the gut. There's that component there too. You can also do an endoscopy, right? Endoscopy, I don't love it because you have a lot of late stage indication of whether or not there's a sensitivity. And so you're looking at the microvilli, you're looking for a flattening of those microvilli. And so typically there's like what's called in endoscopy world, like a Marsh score. And I think it's Marsh score 2 to 3 is that flattening of the villi starts to happen. And that indicates microvilli, indicates gluten sensitivity. That indicates gluten sensitivity. So Marsh score 1 is normal. These are the microvilli. As they flatten, that's like a Marsh score 2, Marsh score 3, and then totally flat, that's a Marsh score 4. So it's 1 through 4. And so that's what your gastro person would look at and probably rank you on that scale. And so there has to be a lot of prolonged inflammation for that villi to shrink. And the microvilli are important because these are the little mini vacuum cleaners in your small intestine that suck up nutrients. And so the more you inflame those nutrients, the more you clog that vacuum cleaner with sucking up your minerals, your iron, your calcium, your magnesium, your zinc, really important minerals, magnesium. Also the amino acids, all your proteins that play a major role with your brain function, serotonin, sleep, dopamine, tyrosine, right? This is going to be really important for focus and feeling good. And GABA, really important for relaxing, calming down, kind of downshifting from the stress in your day. So these are important things to look at when you are trying to, understand the damage that's happening. And so you have the endoscopy part. We talked about the blood test. We talked about the endoscopy. You can do stool tests too, and you can look at antibodies from the stool perspective. This is better because you're getting an antibody that's closer to the gluten, right? Gluten's in your intestinal tract, your stool is moving through there. So you have a greater chance of having more of an immune response. Also, interepithelial lymphocytes, IEL. These are blood cells in the intestinal tract, and those are going to be there because the gluten is creating an immune stress.